Why don't we use bronchodilators like salbutamol in bronchiolitis? Bronchiolitis is a virally induced acute bronchiolar inflammation, and it's seen in infants up to about 2 years old. It's most commonly caused by RSV, but other viruses like adenovirus and rhinovirus can also cause it. It presents similarly to conditions like asthma, with a diffuse wheeze associated with that viral infection. So, why does NICE recommend SABA, and for that matter, LAMA use in those conditions, but not in bronchiolitis? Well, to understand that, we need to have a look at the anatomy of the airway, we need to have a look at the pathophysiology behind both conditions, and the mechanism of action of the drugs involved. So, the anatomy is shown here. In large airways, you have a layer of cartilage on the outside, and that's seen in white. Then you have your smooth muscle layer in red, followed by your mucus lining, which has goblet cells that produce that mucus and help clear the airway, and your ciliated lining, which moves that mucus up and down out of the airway. Beta agonists and muscarinic antagonists work on the smooth muscle layer of the airway. Beta agonists, like salbutamol, work by stimulating B2 receptors, and this relaxes the smooth muscle in the airway. Muscarinic antagonists work by preventing acetylcholine-mediated bronchoconstriction, so they prevent bronchoconstriction. Asthma is an atopic condition. This means you get an eosinophil-mediated reaction to certain triggers, things like cold weather, exercise, viruses, or pollen in the airway. This results in a histamine release that causes bronchoconstriction or smooth muscle hypertrophy, narrowing the airway. So, the action of SABAs and SAMAs are directly opposed to the pathophysiology of the disease. In bronchiolitis, the obstruction of the airway results from a slightly different pathophysiology. Inflammation here is instead mediated by neutrophils and macrophages. First of all, you get proliferation of goblet cells, and this causes excess mucus production within the airway. Secondarily, RSV will cause inflammation and destruction of the ciliated epithelial cells. This will cause ciliated cell sloughing within the airway, but also reduce mucociliary clearance, so that excessive mucus can't be cleared. And lastly, you're going to get edema, that is, excess fluid in the airway, also blocking the airway. And you've got those three processes all at once. However, you'll notice that none of this is related to the smooth muscle, and there's no bronchoconstriction. Therefore, by attempting to relax the smooth muscle with SABAs or SAMAs, you will not relieve any of the obstruction. Instead, in this condition, treatments are focused on clearing the secretions, giving oxygen, and this idea of positive end expiratory pressure.